This is Dr. Shilpi Reddy and you're watching Super Healthy Super Mornings with Dr. Shilpi. Today I wanted to talk about a very important aspect, of continuing the trend of normal deliveries. Still today, the most common cause of opting for a cesarean is a previous cesarean, because cesareans have been happening from a very, very long time, and previous cesarean delivery is one of the leading causes of going for a cesarean delivery now. So previous cesarean delivery could have been done for some emergency reasons, especially the reasons which are not repetitive. Like if the woman has undergone a cesarean, say for placenta which was low lying, or a low placenta, or a placenta previa, or she had severe hypertension and they had to do a cesarean to take care of the baby, or her hypertension or severe diabetes that she had, or there was some need of an emergency delivery. Emergency deliveries can be mother indications or the baby indications. Sometimes suddenly the cord comes out, so they need to do an emergency delivery. Sometimes the baby heartbeat drops, they have to do an emergency delivery. Sometimes the maternal condition is not good, they have to do an emergency delivery. Sometimes the baby size is so big, maybe more than 4.5 kgs, for various reasons they have to do a cesarean. So cesarean reasons are recurring reasons and non-recurring reasons. In recurring reasons, where you have to do a cesarean again and again, there comes a role of a very small pelvis. That is, you call it an absolute gynecoid pelvis, where the head doesn't negotiate and go inside. Then even next time also a cesarean happens. But then it again is very different, because if this baby's head is too small, it can negotiate and go. So cephalopelvic disproportions and some pelvic problems can lead to repetitive cesareans, and there are very few indications where a repeat cesarean happens. But then whenever the woman is pregnant, she can opt for a normal vaginal delivery, and she can go ahead with that choice, because every pregnancy is different, and every pregnancy conditions are different, environment is different. And if the couple are motivated, and if their partner support is good, if she goes through nice training in terms of Lama's childbirth education, antenatal classes, and if the woman is very much interested in to having a natural delivery or a normal birthing experience, definitely they can book at places where they are doing VBAC. So VBAC is vaginal birth after a cesarean. Now there are certain criteria for selection of VBAC, but the most important criteria is nature. Whenever nature decides that this baby should have a normal birth, it will definitely go into labor spontaneously. So that's one of the important aspect. Some woman with a previous cesarean has entered into labor, you can definitely give her a chance of having a normal vaginal delivery. And there are certain criteria, as I have told you, that according to books it should be one previous cesarean. But I have done women who have had two previous cesareans, who have had two previous cesareans, and they've come to me asking for a normal delivery. I have in fact done that, a couple of cases like that, and couple of cases I have done from other regions than what we do here. There are people who've come from Bhimavaram, there are people who've come from Nagpur, there was somebody who's come from Delhi who to have a vaginal birth after a cesarean, after two previous cesareans. So people tend to they tend to pass on the information, and whoever gets that information that I'm doing the vaginal delivery after a cesarean, they just drop in. And once they come for a booking somewhere in the mid-trimester, somewhere around the 4th or 5th month, we keep them into loop and give them some activities and motivate them, and it both online and offline we kind of manage them, because the end result, they want a normal vaginal delivery. But according to books, it says that one previous cesarean, you can go in and take them for a vaginal delivery, and the last delivery should have been at 24 months, see, 19 or 20 to 24 months before, so not before that. But even 10 days back, I had a patient who was very much determined. She was tall, she was very much determined. She came from Vijayawada, and her last child age was 17 months, and she wanted a normal delivery at any cost. And in fact, we went ahead the entire pregnancy. She was following up. Last 3-4 months, she was here around the hospital, and then we took her into intensive mode, and then she had a very smooth vaginal delivery, and she went to Vijayawada very happy. So there are stories, there are exceptions, but the last childbirth, at least 2 years, if the last childbirth is there, then there are good chances of success. All these things are for a good success chance. On an individual basis, the doctor knows what is the capacity of the patient, but then again, on an individual basis, you can track them. So one is the one previous section, the second one is the time before she had the last delivery, third one is head should be down and not the breech. That is another indication. But then I do a lot of breech deliveries, so it is not a problem for me, basically, because breech delivery is an art, and it's a lost art, and people should understand that one of the major reasons for going in for a normal, other than a normal delivery and going in for a cesarean, is a breech presentation. So breech presentations are one of the leading causes of reasons added for a cesarean delivery. And somewhere, if they can do a breech delivery with an ideal weight and good setup, like what I do, I also do breech deliveries, and last couple of months we have done many breech deliveries, and the next week we've got another 2 people with breech who really want to try vaginal delivery, and they want to go for a breech delivery. So this is another choice. They should be motivated, and they should be it should come from their inner self that I should have a natural birth, I should have a natural experience, I want to deliver normally. So in such situations, wherever the setup permits, like I have 2 labor rooms, one beside the other, and the next room is the operation theatre. 24/7 I have anesthesia staff, there's a blood bank, there are trained people, I am there, my registrars are there, all post-MS, and they are also very enthusiastic. So in such given situations, we can really go to another extent and give whatever possible. And this is what really is the need. Team, the entire team matters a lot, and the entire team puts in the effort along with the pregnant couple, because if the pregnant couple are not motivated, even I want to do a breech delivery, even I want to do a vaginal birth after a cesarean, it would definitely be not possible, because it's not my choice, it's the pregnant couple's choice and their motivation to go ahead and have a vaginal delivery. And it takes a lot, other than the determination, little bit of physical fitness, little bit of training on the pelvic floor, strengthening exercises, back strengthening exercises, and a day-to-day activities that we give them, and self-relaxation methods that we tell them. So all these things make a lot of difference. And giving a vaginal birth chance is it's like a miracle for them, because they've always come from places where the people have influenced that this is not possible, and they are fighting with that mode, that whether it is possible or not possible. I always tell them, what maximum will happen? Anyways, you will be posted for a cesarean. Otherwise, why not try a vaginal delivery? When that can happen, it will definitely happen. And whenever I try to induce for a normal vaginal delivery, unless and until it is a baby indication, like there are any heartbeat variations of the baby, or it is absolutely not progressing, we take up for a section. Otherwise, it is always the plan and action and the target and the results always match. And I do it in such an environment that everything is planned, they get admitted planned, and everything is executed as per plan. So this way we can, cut down on unwanted things happening, or some emergencies happening, or they losing water in the house and coming. All these things can be curtailed. And vaginal birth after cesarean is a very unique concept, wherein the experience of labor itself is very it's a life experience for the mother. And once the delivery happens, she'll be good to go the very next day, and she'll be back to life, and she'll be able to take care of the entire family along with the last child that the woman has. So back to normal is important. There's less of blood loss, there is less of surgical interventions, and there's no need of bed rest as such after a normal vaginal delivery. She all that she needs to have is just a little rest at home. No abdominal scar, so there's no question of non-healing or hernias at a later date, or any other problems at a later date. So there are a set of advantages, and there are a set of disadvantages also, because they can lead into emergencies and emergency cesareans. And emergency cesarean has its own kind of risk factors. But then in a well-planned setup where everything is available and a backup is good, the results are absolutely under control. It all depends on the system. It all depends on the place that it's there. So suddenly you need blood, and you don't have a blood bank in the hospital, or you don't have any blood reserved in the hospital. That can lead to problems. So it is always that you have to be very well planned, and it's a planned execution of whatever high risk situations that we deal with. And it is important that in labor also they are motivated, it goes through smoothly, and you have to have a very good NICU team to support all these high risk deliveries, because they are the ones who are at the back end giving us assurance and reassurance that everything is well managed and going to take care. And the pediatrician, we regularly do some kind of counseling for the pregnant couple, so that they are also reassured and they are also in sync with whatever the plan is. And vaginal birth after a cesarean is been there from a very long time, and once the body decides, everything happens on its own. And good support, good in-house labor support team who encourages the woman, who gives various kind of activities for the woman in labor to not to focus on pain and to focus on something different other than pain, like targeting a vaginal delivery and always thinking positive is very, very important. The entire team matters a lot, and the results are very good whenever you are contemplating this kind of a delivery. And when you have to talk about risk factors and advantages, I always say that advantages are outweighing the risk factors. That's why even for us it is an easy on thing to go ahead. But if the infrastructure is not good, nobody is willing to take risk. So the risk has to be from the patient side and from the doctor's side, and everything has to be executed in a well furnished setup and not haphazardly. And that is really, really important. And when it comes to vaginal birth after a cesarean, the entire experience is it is really good. And I have had women who have had VBAC and breech deliveries, and we will do one entire session on breech deliveries also. So they are extremely happy at the end of the day. The next day when we go and see them for the rounds, they are beautifully smiling, and they can move around, and they can carry the baby, and they can latch the baby, and they are extremely free in terms of activity, and they're confident to go with the very next day. And except for the perineal pain where the sutures are, episiotomy is a choice. Some people don't even ask for episiotomy, so it's a choice. So definitely that suture pain will definitely be there for some days. Other than that, everything else is smooth, and very well planned and executed, it is quite a number of times it is uneventful. And we should encourage vaginal birth after cesareans, because this is the way that we're going to reduce operative interventions, and this is the way that we're going to add on to a positive thing about natural birthing and normal delivery into the society. And there are a lot of places where their infrastructure is not cooperating, and they come from different cities. I have had one woman who's come from New Zealand to have a vaginal birth here, because she had 2 previous cesareans there, and she wanted to give a trial for vaginal delivery. And I had one patient who came from Switzerland, an Indian patient, but unfortunately they had 1 cesarean there the previous time. They were so much motivated. That was a high risk pregnancy. That's why they had a cesarean there. And the next pregnancy I managed online, and they came here and delivered. So the stories are endless, and it's about how you treat your patients, and it is how you talk to them, and how you take them into confidence. And hi Viji, how are you? So this was supposed to be my last night party dress, so the party was cancelled, so I wore it today morning. So thank you for your compliments. And then we will take questions online wherever possible, so that it will be an interactive session. And it's all about birthing experience. It is all about encouraging natural birthing and normal deliveries. It is all about taking care of your entire family, yourself, and putting wherever your strength is. Medical procedures are always there, which are better than the other. But it's all that the woman should be willing, and they should be highly motivated to enter into a system of normalcy and to take confidence. There are several places where the friends or the family or some other people say that, why do you want to take risk? Risk is there everywhere. So why there is risk everywhere? You go onto the road. Is it not risky, but you don't have any fault and somebody hits you and goes? So risk is everywhere. So risk taking is everywhere. For just not a reason of risk taking, or just not the reason of a muhurtam delivery, or just not the reason of an auspicious day, you should not give away the choice of natural birth. Natural birth is the right of the woman and the baby also. You know how advantageous is a vaginal delivery over an abdominal delivery. Only in long-term studies are saying that the vaginal flora which is exposed to the baby is extremely beneficial the entire life of the baby. Not only that, there will be lesser breathing difficulties, lesser breathing problems, more immunity levels, and lesser number of NICU admissions for respiratory problems. And it's a slow process, so the baby accustoms to the external environment. There are so many advantages. Here and there some problems come in, but then otherwise vaginal deliveries are always better than any kind of an alternative delivery. Alternative delivery is definitely an alternative delivery, but vaginal deliveries are called as normal deliveries because they are really normal, and they establish normalcy as soon as possible. So yet another interesting topic tomorrow, and we should encourage vaginal deliveries, and vaginal delivery after cesarean is the right of the woman. VBACs should be encouraged, and VBACs should be made safe by keeping the environment around the pregnant woman in the hospital safe. Well-trained team is important for vaginal birth after cesarean. So tomorrow, yet another topic and an interesting day. So catch you tomorrow morning live, 7:30 a.m. Yet another super topic for women's health and natural delivery.